Thank you so much for joining today's webinar. I appreciate everybody taking the time to join this discussion. This is Ann Garvey with Iowa Department of Public Health, and Carmelie Stone and I are going to be presenting information on today's call. And certainly we'll have time for question and answer at the end of the call. As always, these will be archived and the link will be posted on the HON. Really, the crux of what I want to talk about today is the case investigation and contact tracing processes. I told you on Friday's call that I have more information available on how this process is going to work and how we would work with our local public health partners to operationalize it. And I want to give you some additional detail today. And again, certainly I'm sure you're going to have follow-up questions and we'd welcome those. So the first thing I want to say, though, also is thank you for your flexibility and your patience. We know that this has been a changing process, and we appreciate you kind of rolling with things with us as we figure out how to make all of this data flow in a way that still allows access to it at the local public health level and at the state public health level. I want to just start by reiterating that we had sent out a survey to all of our local public health partners in the last couple of days, asking them if they wanted to continue to do case investigations for their jurisdiction or if they wanted to turn them all over to the state team. And I just want to reiterate that this is a local decision and we're not mandating that anybody turn over any investigations. I think there's been some kind of misinformation or some discussion saying that the state is mandating that local public health turn over those investigations, and that is not at all the case. As our local public health partners know, we have sent out a survey asking local public health to tell us whether they want to continue to do those investigations or if they want us to do them with the state team. So again, that is a local decision. There's not a mandate that those be turned over. The one thing we are not able to do, though, is kind of subdivide cases. So prior to starting this new process, we had a Google sheet where we were asking our local public health partners to just enter cases that they wanted us to work, and then they would pick which ones they wanted to work. And just with having to navigate that with 99 different counties, it's just not logistically possible to continue to do that. And so we really are asking our local partners to make a decision. Would you like to do all of your investigations, or would you like us to do all of your investigations? And again, this is not set in stone. So if a local public health department changes their mind either way during the course of the rest of the response, we can certainly adjust accordingly. If you got questions about this, please let your field EP know, or you can reach out to me as well. I want to take a minute to kind of talk through the data flow so that everybody understands what information they'll have access to. So the lab, we had talked briefly on the last call about potentially transitioning to use a different system called Domo for case investigations. We have decided not to go that route for the investigation piece of it, and I'll talk later about how Domo will be used for data visualization. But for the investigation piece, labs are going to continue to flow into IDES. Eventually, the Test Iowa results will be reported through IDES as well. This is a process that we're working on, and we should have results appearing from Test Iowa appearing through IDES in the coming days. What we're doing on our side for the investigations that are being done from the state perspective is we're exporting those cases from IDES and assigning them to the National Guard teams that are working with us to conduct investigations and contact tracing. And I'll talk about contact tracing here in a minute. The National Guard teams are conducting those interviews and doing the contact tracing and entering that investigation data into REDCap surveys. So that's how we're getting that information back from them, because as many of you know, IDES is not the most intuitive system sometimes to use, and the logistics of putting 150 people in the system was a little bit difficult. And so we're going to be entering that data back into REDCap, and then our IM department has been writing a query that would then put all of the investigation data from REDCap back into IDES. So the complete investigation data and the laboratory results are going to be accessible in IDES to all local public health partners, regardless of whether you're doing the investigations or not. All the data is going to be in that in the IDES system, just like it normally is, so you can access it there. We are having another team of about 20 IDPH employees who do have IDES access. They're going to be working in IDES to call the cases to confirm recovery 7 days after their illness onset. And again, that data will be entered into IDES, so that'll be accessible by local partners, and then they'll actually be closing those cases. So hopefully that process or that description helps everybody kind of understand where the data is and how you can access it, and how we're working with our contact tracing teams to make sure that we get that information back into IDES. We have gotten a request from some of the counties that are not doing their own investigations, asking that we turn off their IDES notifications. We are not able to do that because all of our local public health users are listed under the same rule within the IDES system. And so the notifications are really based upon the role within the system. And so we cannot turn it off for some local public health partners and leave it on for others. I apologize. I know that it's frustrating to get all those emails if you're not doing those investigations, but there's not a way currently, at least, to do that within the IDES system. I think we all know that IDES was set up in a specific way to do a specific task, and what we're doing right now is, we're trying to incorporate some very specific response related activities into it, and the system is somewhat flexible, but there are some constraints still. So I apologize, but we aren't able to turn notifications off for a subset of counties. So here's the biggest change. We're being asked to start doing more full contact tracing. And so that's similar to what we did at the early stages of the response. And so we're asking that all persons that the case has been in contact with for over 30 minutes within 6 feet during their infectious period, we're asking that those individuals are contacted. And we're including both individuals within and outside of the household. And so when I say in contact with that person, it would be during the case's infectious period. And again, the infectious period for cases are, if you're asymptomatic, 48 hours before the day the person is tested until 7 days after the day they were tested. And symptomatic persons, the infectious period is 48 hours before their symptoms started until they meet the rule, the 7-3 rule. And I think we've started terming it that. I think our local public health partners are familiar with what we're talking about, but just to be sure, what I mean by the 7-3 rule is that it's been at least 7 days since symptoms started, and that the person has been fever-free for at least 3 days, and that all other respiratory symptoms have improved. So that would be the infectious period for any of the cases that are symptomatic. So again, we would ask that people follow up with the identified contacts. If those contacts are asymptomatic, we just tell them that they need to be isolated through 14 days after their last contact. If any of those people are critical workers, we would also recommend sharing the critical worker guidance that we talked through on the webinar on Friday. And then, as always, just track those contacts in the contact section of IDES. If someone is symptomatic when you contact them, we would recommend that they be isolated until they meet the 7-3 rule, and then they also be entered as a new case in IDES and epi-link it to the original case. So I know that this is additional work, and again, we greatly appreciate everything that everyone's doing, but we are being asked to kind of extend this contact tracing so that we're being a little more aggressive and really trying to identify those contacts again, both within and outside of the household. But what I would say is, we're talking about people who have been in contact with the case for at least 30 minutes within 6 feet. And in the current climate of social distancing and how we're still asking people to take certain measures, this hopefully should not be a huge number of persons that this type of contact is occurring with, but certainly we understand that this is an increased workload. And so we are going to make some changes to the IDES form to make this more clear under the contact tracing section. Those changes will be reflected by Monday, but certainly if you have questions, let us know. I know this is a change, and I appreciate your flexibility with this. So again, we had mentioned Domo on the last webinar last week, and again, we're still going to be using Domo, but really more on the data visualization side. So over the course of the next week, we're going to be transitioning away from our current data visualization. Right now, the way that the data is getting inputted on the dashboard on the website, the COVID website, is through Tableau. So our APIs are manipulating all that data, creating those dashboards, and then posting those daily. And so this will be transitioned again to Domo, which will be a more real-time type visualization, more automated, and certainly I think might be able to give us some additional data points. So at some point, there may be additional county-specific data that would be accessible, but again, I don't have a timeline for that yet. So I just mentioned that as something that might be a possibility down the road. So at this point, I'll transition to Carmelie. Carmelie, do you want to talk about the strike teams?
Yeah, thank you, Anne. Can you hear me okay?
Yeah, you sound great, Carm.
Okay, great. Hi, good morning, or actually good afternoon, everybody. My name is Carmelie Stone. I am the Bureau Chief of the Bureau of Environmental Health Services of the Iowa Department of Public Health, but I am currently serving in operations and planning in the IDPH Emergency Coordination Center out here at SEOC in Johnston. So I will update you on our testing strike teams. Let's see. Can you go ahead and hit the net? Yep, there you go. Thank you. All right, so I'm only going to talk about testing strike teams today. I know there have been the testing strike teams, prevention teams, and other teams that have been identified, but today I'm just going to talk to you about these testing strike teams. Currently, there are long-term care testing strike teams and business testing strike teams. The long-term care testing strike teams are testing the staff of the long-term cares, and currently the business testing strike teams are testing at meat packing plants identified and prioritized by the governor's office. So these are identified and then prioritized by the governor's office, and then the governor's office has a list and then asks us to work on setting up these strike teams. So we have several steps that we take in the ECC to set up those strike teams. There's the initiation step, the staffing step, supplies and PPE, the laboratory capacity, site assessment, deploying of those staff, and then what we do on the day of the missions. Next slide, please. So the initiation step, after the governor's office says, here's the county that we want you to go test the long-term care staffing in, or the business, the notifications that take place during that step is the state hygienic lab, the local public health and local emergency manager, and the Iowa National Guard. All of these are very important partners that we have, and who we are working with and notifying when one of these strike teams needs to go to a county. The first step that I take is calling the business, and there is a conference call that happens with the business testing strike team and the IDPH ECC. During that business testing, during that first initial conference call with the business, we identify the dates that they want to have their manufacturing plant tested. And those tests are serology and swabs both. We get the times, we get the staging times, we get testing times if they need staff. A lot of these places need a staff, need the staffing strike teams, and so that's what takes us a while to put together, as well as the number of tests that we're going to do. Currently, the missions that we have in progress have been anywhere from 175 to 3,000 employees that we are testing. And so most of these missions are taking 2 days for us to complete. We're looking at the type of facility that they are using. I'm following up to find out what kind of languages they have in their plants, because there are many that have non-English speaking workers. Some of our plants only have Spanish. Other plants have up to 35 languages that they speak. I'm trying to get that ahead of time for contact tracing and case investigation. For our long-term care testing strike teams, the iGov representative is contacting the the long-term care administrators in the county to set that up as that first initiation step. Next slide, please. So for staffing, an iServe request is sent out for the staffing. At first, we were trying to gather the staff who were interested and do a conference call with them, and then have them send an email back to us and say, yes, they were interested. And we felt like we were missing some important information and maybe not always communicating the same way every time for those staffing requests. So we have a new process, which is sent out by iServe, and you may have seen that if you're on our iServe list. That was done, I believe it was over the weekend, with a Google form. This Google form that we sent out had several missions on it. The iServe staff who received it were able to check a box and say, yes, I'm available for these missions. That made it much easier on the back end for us to determine we could send out several missions at once. We were able to find out who was available and when, and that just worked really well for us. Now, the first time we sent it out, we didn't unlock it, and so only state of Iowa employees could answer it. So then we had to send it out a second time being unlocked. So I will not make that mistake again with the number of phone calls and emails that we were getting, but it's just something that you learn as part of the process. We then sort out those responses for those missions. So like this last Google form that we sent out, I think there was probably 6 or 7 missions on that. So now we're able to sort those out by the missions, and we know which staff that signed up are available for which missions. And we actually currently have almost 600 responses on that Google form for the missions that we sent out. So we are extremely happy with that, and we almost have more staff than what we actually need. So this was a really good improvement to our process. An email is then sent out to those who responded to that mission. And then we ask them, are you still available? And if they get back to us, then we start assigning the people for those missions. And this happens with both the long-term care missions and the business strike team as well. A lot of some of our long-term care missions are also being staffed by our sister agency, Department of Human Services nurses as well. Next slide, please. So you may be wondering where our supplies and PPE are coming from. So all of these missions, again, are swabs and serology. And so those pieces of equipment are being supplied either by the laboratories or by the Iowa Department of Public Health, ECC. Other needed supplies and PPE are supplied by us here at IDPH ECC. And so we are supplying those supplies and PPE to the IDPH lead staff who are on the ground and serve as our representative during this mission. We are supplying the supplies and PPE to our iServe staff who we have assigned to this. And then we are also supplying the PPE to the Iowa National Guard. Now, some of the PPE is also provided by the businesses, but this is something that we cover at our first initiation call on whether or not the businesses can provide PPE, and if they can't, then we provide it. So it really is a joint effort depending upon which facility we are at. One thing that we need to do a better job of is notifying hospitals that may be in the area of where we're doing these missions in advance in case we have an emergency need. That did happen over last weekend while we were at a manufacturing plant, and we had some really good, we just had a really good luck with reaching out to a couple of hospitals where we were, and they provided us with what we needed in an emergency, particularly because we were away from Des Moines. We need to do a better job of doing that in advance. And then we also are coming up with a need for the plan to pay back those supplies after this event is over. We're also asking the manufacturers when we go into the plants to provide lunch for the staff. These staff are working anywhere from 10 to 12-hour days, potentially for 2 or 3 days in a row. So the manufacturers have been more than willing to provide lunch and snacks for the staff who are providing these services for them. So that has been a great partnership with them as well. IDPH is providing lunch for the long-term care staff when they go out to do the long-term care testing missions. Next slide, please. So laboratory capacity. Currently, the turnaround time is anywhere from 48 to 72 hours, depending upon how many are coming in at once. We are bringing LabCorp on board to help us with swab and serology testing, as well as using State Hygienic Lab. The labs are communicating the results back to the manufacturers in one way or another to share positive and negative results with them and their employees. The long-term care results are coming back to us through IDES as well. Next slide, please. A site assessment. So but even before we get to the site assessment piece, we are connecting the IDPH lead, the Iowa National Guard lead, and the plant manager to begin discussing what they have available at their site. Right now, several of our sites are using tents, and some have used inside of their buildings, but tents have proved to be an issue with weather. It is spring in April, or it's spring in Iowa. It's also April. So it's also spring. But anyway, it's spring in Iowa, and so we've dealt with wind, rain, tornadoes so far, and so that's been really interesting on top of everything else. But the day before the mission, they're doing a site assessment, and that is performed with the plant manager, the IDPH lead representative, and the Iowa National Guard. The afternoon before, they are setting up the stations, and they are testing the flow and where the flow, how are the employees going to come in to the testing stations? How are they going to exit the testing stations? We want them going one direction, not crossing each other. And so what works for the most efficiency? We learned a lot of lessons from the missions over the weekend, and so we are improving our efficiency at this every day. But it's really been trial by fire, and how do we get these as efficient as possible? We also are having them take a look at social distancing, of course, for the lines and the stations as well. Next slide, please. Deploying of staff. So our iServe staff are sent our HR forms to bring them on board. If you get any questions, these are paid positions. I think some people have responded thinking that they're going to volunteer, but these are paid positions. So they're sent our HR forms to bring them on board so that we can pay them. And they're sent a training video of the collection of nasal swabs, plus an email that just has all of the information that they are going to need for that day. They're giving the staging times, they're giving their mission times, how long they will be there. And then we are also providing hotel and mileage from those who are outside of the area. We are looking for people who are local, so that they can serve a local need in their area. But if we are unable to fulfill all of the numbers of positions that we need locally, then we are looking outside of the area for staff who had volunteered. And like I said, the IDPH ECC and the IDPH Finance Bureau do then go out and schedule hotel rooms and pay for that as necessary. Next slide, please. The day of the missions. So the day of the mission, day one, if it's a multi-day mission, we are staging 1 hour ahead of time. That gets the nurses there. They get through any HR paperwork that we need to do with them. They kind of get a lay of the land. They know what's going to occur, answer any questions ahead of time, and then get everything ready so that when the employees start coming in, they're sitting at their or standing at their desks and they are ready to go. The Iowa National Guard is then helping us with security of the sites as well as the flow. So they're helping with potentially long lines of people depending on how the manufacturer has scheduled them to come in. And so they have been just a great partner and are supporting us in many different ways throughout this pandemic. The IDPH lead on site provides the site management of the iServe staff. They are monitoring the time along with the plant managers usually of how long it's taking people to get through the line to know, do we need to get people through faster? Are we going to be able to get through in the time that we have allotted for our mission? Or maybe we're going to get done early and send everybody home and everyone gets super excited. They also need to be monitoring inventory to make sure that we're not burning through things faster than what we initially thought. They're also our contact for the IDPH ECC so that they can call us if the emergencies arise or if they need anything. They are our main point of contact at the site because the ECC is not on site. And then they coordinate with the plant manager or the long-term care staff on site. So yeah, these are really, really important missions, both for long-term care staffing and for the business strike teams. And we just are really, really appreciative of all of you who are volunteering and all of you who are providing healthcare during this time. So I will end there and we'll keep going.
Great, thanks, Carm. So I just want to clarify a few things related to lab results and case investigations that are resulting from the strike team activities. And so the lab results will flow into IDES just like any lab result that comes through a healthcare system. Regardless of whether the testing is done at LabCorp or at the State Hygienic Lab, those results will come through the same. And we, for some of the early strike team activities, we did try to do facility-specific kind of questionnaire. We just, due to volume, we're just going to do our standard questionnaire with everyone. So again, if you're doing your own interviews, we would, in your county, when we have these strike teams come through, these are going to come across just as the normal, any type of IDES report of a positive case. The negatives are also in IDES. If you want to do a query for that, you absolutely can. And then the other thing that I would mention is, I think Carm kind of touched on this, but we're trying to order the testing through the occupational health medical director or the medical director at the facility. So then those facilities are responsible for doing the initial notification of the employees, and then we'll follow up and do the standard investigation. And I know we've learned that by trial and error as we've moved through it. We're trying to make sure we can identify these cases in IDES just for the numbers process, but then also transitioning to have the facilities themselves notify their employees of the results, since their medical director or occupational health director is the healthcare provider on record for ordering the test. So, all right, that is the prepared information that Carmen and I wanted to go over with you today. So we'll transition to taking questions. We've got quite a few in the Q&A box. Some questions about does IDPH support the governor's decisions? And absolutely, we're working to support the governor's office, so we don't have any additional information. I am from a hospital laboratory, and there have been supplying testing supplies to our, and have been supplying testing supplies to our area nursing homes. How do I obtain testing supplies from IDPH for a large number of patient screenings? So there's kind of two routes here. So if this is a strike team situation like Carm described, then absolutely those supplies will be coordinated through the ECC. If the facility is just asking for additional supplies, to do testing, those supplies can be ordered, and that testing is going to be done at the State Hygienic Lab. Those supplies can be ordered through the State Hygienic Lab website, and there's just a order clinical test kits link on their website, so you can just go in there and order the supplies that way. IDPH currently shows positive and negative test findings. The information is useful but subjective on the number of tests available or given. To truly get a good grasp on the spread and control of the virus, should we not be doing a daily tracking of new hospital admissions? This number would show how each county is following the flow. This number is most accurate and available, and each county can then graph their own curve. So I would direct you to the website, the COVID website, where we do have hospitalization numbers. In addition, we're working to make hospitalizations by county available in the future as well. So I think that will address the concerns raised here. So we have some comments back on kind of the governor's proclamations and decisions, and I guess those are not necessarily things that Carmen and I can speak to. So we're gonna forego those questions and really just stick to the questions related to kind of the operations and things that we're doing.
Okay, the next question says, are meatpacking plants part of the critical infrastructure piece for the SHL testing? So I'm not sure if I understand what critical infrastructure means, but go ahead.
Yeah, so from the standpoint of whether the testing can be completed at the State Hygienic Lab, so there's a couple of moving parts here. There's about 3 moving parts here. So obviously, when we do these strike teams, that testing, as Carm mentioned, is being completed by the State Hygienic Lab, or in some cases now LabCorp. In addition, if a business has reported a 10% illness in their employees, then that business is provided with some documentation that can be used with employees that are symptomatic. And those employees would then qualify for testing at the State Hygienic Laboratory. We had gotten feedback that sometimes ill individuals in these business outbreak type situations weren't getting approved for testing because they didn't meet the other qualifying criteria. And so in these 10% absenteeism situations, they are qualified for testing at the State Hygienic Lab. I think the other piece of this question gets to the critical worker guidance that's available on the on our webpage and also on CDC's webpage. I think we talked about it on Friday's webinar, but basically it indicates that exposed critical workers can continue to work as long as they wear a mask and also take some other protective measures. And so that's outlined on our website. Do we know how will CAH know who is doing the investigations for our county? And will that affect the expectations from the CAH? I'm sorry if I'm just not thinking of this clearly, but can you respond back and tell us what CAH stands for? The bottom line is the local health department decides who's doing the investigations for the county. And so the only stipulation we say is please do all of them or please turn all of them over to the state. So it's a local, oh my gosh, it's critical access hospital. So I'm sorry. So if you have questions about who's doing the investigations for your county, please contact your local public health department. CDC recently expanded COVID symptoms. Many nursing homes are now screening for loss of smell, taste, etc. Should we update our screening at hospitals? will IDPH follow the symptom guidelines? And we are still kind of working through that process. Some of the symptoms are a little more subjective, and so we may include some additional symptoms in our investigation process. And we're talking through whether we would change the screening guidance. We have not made a recommendation to change screening guidance to include those additional symptoms thus far, but that may be something we'll do in the future. Can you explain the process of what happens when we test someone not a resident in Iowa, please? Who notifies who if we have a positive? Who investigates? Does the statistic go against the state of permanent residency? So good question. So if a healthcare provider tests a patient, regardless of where they live, that healthcare provider should notify them of the result of that testing. The laboratory result gets reported to the state where the individual resides. So if someone from South Dakota gets tested in Iowa at an Iowa healthcare provider, then that healthcare provider should notify them of that result and continue to provide patient care as they would normally. But then that lab result goes to the other state, and that state conducts the investigation, and the case for the purposes of surveillance and tracking would then be counted based on the residency of that individual. So basically where the individual spends most of the year. Sometimes that comes in with like snowbirds, for example, that will go south for 2 months. If their permanent residence is in Iowa and they reside more than half the year in Iowa, then it remains an Iowa case. If COVID positive patients are still having symptoms at 7 days, will this case still be followed up until they're symptom free? Yes, we would ask that that occurs, and that's the process that we're going to take at the state level as well. I know I didn't get into that level of detail, but again, if we follow up with someone and they're still having symptoms 7 days out from onset, then we ask that they be followed up with again 3 days later, and we continue that 3-day interval until that individual has recovered. Will the local infection prevention at the hospital be informed of outbreaks at long-term care or manufacturing plants by their county local public health departments? So that's probably something that from our perspective, we are trying to notify local public health when we get reports of 10% illness. We'll make sure that that continues to happen. And then I would assume that the local public health departments are communicating that as appropriate. A question about whether the Test Iowa test is a PCR test, and yes, it is. Just to clarify, if we're doing our own investigations, then we will do them for Test Iowa as well. And we will do our own 7-day recovery follow-ups. Is that correct? Yes, it is. So basically, if you're doing your investigations, you would do all of them, again, regardless of whether they were tested at SHL or LabCorp or wherever. And then we would also ask that you do the 7-day recovery follow-ups. Thank you. There's some requests that we send out guidance about critical workers and meat packing plants, and so we will do that. That is posted on our website as well. I can try and do the share the screen thing because we have a couple of questions along those same lines. All right, so the way that you get to this is just by going through IDPH to our main page, clicking on the Corona here. I can back it up. clicking on the Corona banner and then clicking on Essential Services Personnel, and then the first link up there is the Critical Workers Guidance. So you'll see that it includes all different types of food and agriculture, manufacturing, transportation, so that would include packing plants. And it discusses that these individuals, if they are exposed, can continue to work with a face mask at all times and social distancing. So I'd advise you to take a look at that guidance if you need additional clarification for the critical worker guidance. A question, can you clarify, is the Iowa National Guard performing all Test Iowa investigations, not the individual counties? No, that's incorrect. So basically, if a county is doing their own investigations, then they would do all of them. That would include Test Iowa and anybody who was tested through any other mechanism. If the county would like us to do their investigations, then we can do that, and we will do all of them, regardless of whether they came through a healthcare partner or through the Test Iowa process. So again, we're trying to just streamline it. So basically at a county level, you would either do everything or you would turn it all over to us. A question about how close contacts apply to the healthcare system. And so again, I didn't get into that level of detail. I'm sorry, I probably should have, but if an individual works in a healthcare system, then we're directing that individual to tell their employer, and then the employer can do contact tracing within the facility to determine what healthcare coworkers and what patients need to be notified and so on. And so the process of a confirmed case in a healthcare worker is not changing. We would recommend that you still follow those procedures. When cases are called 7 days from onset, will the case be closed, or will they remain open until the 7-3 rule is met? They will remain open until the 7-3 rule is met, or if they're asymptomatic, 7 days out. So they won't be closed until the individual meets the criteria related to whether they have symptoms or not. I understood that we are asking asymptomatic cases to isolate for 10 days. So the new CDC guidance, and I'll see if I can walk us through that here on the website under healthcare return to work guidance that they issued recently, says that they recommend that, let me get to the right place. Basically the 7-3 rule, or if they are asymptomatic, you should see that on your screen, then they should be excluded for 10 days. So that's for healthcare workers. There's asking for clarification of what would be considered exposure in a healthcare worker. We're not recommending the 30 minutes within 6 feet necessarily for the healthcare setting. We would still recommend using the 2 minutes, but we'll clarify that in guidance. I'm seeing quite a few questions about that. So the CDC guidance doesn't really spell that out. And so we'll make sure that that was spelled out in previous guidance documents. So we'll make sure that we clarify that. Will there be different isolation guidance for healthcare workers who had contact with a positive case? So the return to work guidance for healthcare workers is listed on the website. We just went through that. And then also the exposed critical worker guidance is also available and would be applicable for people who are not infected but who were exposed. So some questions about outdoors and whether we would consider someone to be exposed if they're outside and within 6 feet of another individual for 30 minutes. So I think we would probably just say a blanket 6 feet within 30 minutes, regardless of the setting per se. We can talk about that internally and try and get some additional guidance out for that. So how would businesses be notified to find out if there are coworkers who might who might have been exposed? And so persons who test positive, we're recommending that they notify their employer so that they can do that follow-up. Can hospitalized patients testing be given priority at SHL? The delay we are seeing is causing serious patient flow and PPE concerns. We understand that the testing results have been a little more delayed in recent days, and that's part of all of the testing that's being done. So we understand that that's caused some frustration and issues with workflow, but we would recommend that from the standpoint of we know that the State Hygienic Lab is trying to prioritize hospitalized patients and the healthcare patients as much as possible. But again, we just ask for your patience as they're trying to work through their testing flow process to address any kind of delays and just trying to make sure they're maximizing their efficiency. So we're aware that some of the results have been more delayed than they have been in the past, and everybody's trying to improve that turnaround. Would we go back and do contact tracing with patients we admitted to IDES over the weekend, or just begin with new cases? We would just begin with new cases going forward. And so, we're asking that everybody do this as of Monday. If you want to do it today, absolutely do it. That's your decision. But again, we're asking that everybody start doing this as of Monday. Can we clarify whether childcare workers are considered essential workers, or only childcare workers providing care for children are essential workers? Okay, so I think that level of detail, we probably need to reach out to the Department of Human Services that puts forth the child care guidance. So we'll connect with them and try and get some clarification. What if a county does not want a strike team? Can the county work within its own infrastructure to conduct testing if we have the capacity to test all the patients and staff at a nursing home or at a business within our community?
Yeah, I think we can talk through that, and that actually makes things go faster. I'm sorry, this is Carmelie. I have been working more on the business side of it, and so we are asking the businesses if they're able to take care of this themselves. With maybe the occupational nurses that they have. The problem has been that a lot of the occupational nurses that businesses have not done blood draws for quite a while, and so they're not comfortable with that, which is why we're finding additional staff for that. So yes, if a county would want to do that and do the swabs and the serology, we would definitely work with you on that.
Is local public health involved with testing performed with the strike teams? And
yeah, so again, it's usually been a capacity issue. We are notifying local public health when those places are identified, and so when we notify them, I'm talking to them about the staffing piece of it, or I'm trying to remember the conversations I've had lately. But we are, a lot of it is a capacity issue, honestly, because we're having to send 20 to 25 nurses or healthcare providers to do the serology and to do the swabbing. And so I know counties don't have the resources right now to do that. So, but yeah, I am calling the county to let them know it's coming, and asking how they want to be involved, if they want to be involved.
Okay. If IDPH is handling case investigations and recovery, if a case calls local public health for more information about their release or with questions, what phone number should we give them to call? Are we to give them the 800 number for CADE? If they select public, they will then be directed back to 211. Yeah, thanks for that question. That's something that we're kind of working on right now. We will continue to use the 800 number, and we'll try and work through that process. The thing I would say, though, is if they're calling asking for some type of support at a local level, some type of assistance, or if they're calling for general information, if you have the ability to answer those questions, I think that would be great. If it truly is something that you're not comfortable answering, or you want to defer to us, then we'll clarify that process to call through the 800 number. We understand that 211 isn't the best route, and we're just we'll try and streamline that. But again, if there's assistance that you can provide locally to answer a general question, or if they're asking for some type of assistance locally, we'd appreciate if you could kind of help with that as well.
The next question says, regarding ICER volunteer survey contact, were all volunteers contacted or just the ones in the specific counties needed? I did not get a survey and I'm on the list. So we did send that out far and wide. I know we sent it to 4,050 people exactly. And so I think we sent it out to anyone and everyone. So please check your spam and please check that your email is correct.
A question, are you checking for current illness or antibody? And so the PCR test, the nasal swab or the nasopharyngeal swab is checking for current illness. The serology test would indicate a potential previous infection. And so we're checking for both in some of these situations, or one or another, depending upon whether the person has been sick. More comments about delayed turnaround time at SHL. I know SHL is trying to manage a lot of different processes, and again, they're working through their test flow, their workflow, to try to address any potential delays.
The next question says, PPE payback to local hospitals if you need to secure supplies from a local hospital. Will you please clarify by what you mean by payback after this event is over? Does the event equal strike team testing or global pandemic? I would like to say that we will try to get you your supplies back before the global pandemic is over, but I can't promise that at this time because we're so busy trying to get these teams set up. What credentials are able to sign up for iServe? Just nurses. We're seeing a lack of EMTs in our area due to illness or contacts, since most of them are volunteers. Anyone, any license, even not licensed, can sign up in iServe. They can put in their, if they're not have a license, even if they can just do administrative work, we're asking people to sign up in there, and then they can put in their skill sets. We're in huge need of administrative staff. We have some MPHs in there that are going to help as well, and so any skill set can sign up.
If members of the workforce of a manufacturer do not live in the county of testing and have relied on the manufacturer for transport to and from work, how do these individuals get tested if the facility is closed? And so in those special situations, we've coordinated with the business themselves to work through those situations. Does an outbreak have to be identified before a testing mission can be offered to local public health? I can jump in here part of the way. So again, with our local public health partners, we ask that they report to us anytime they, have 2 or more illnesses across staff and residents. And so we've had conversations in partnership with our local public health partners with those facilities already. And we're trying to offer more wide testing in those situations where that would be indicated. So as far as does wider testing have to be specifically a strike team mission? No. If the long-term care facility can manage taking those specimens themselves, then we're trying to do it that way. But in those situations where long-term care indicates that they aren't able to kind of man that testing, then we're doing broader.
So I should probably jump in here. The long-term care staffing strike team, or the long-term care testing strike team that's going on right now, is testing the staff of the long-term cares in that county, not the residents in the county, or the residents in the long-term cares in that county. It's of the staffing of the long-term cares in the county. I apologize. Yeah, so local public health is asking us that we request that they be involved. It would provide great experience for them. Got it.
Questions about updating PSAP guidance with additional CDC screening questions. We need to do a little more work on that on our end to go back and see what CDC is recommending specifically, since the PSAP guidance came from them as well.
If someone responded to an iServe request and marked missions available but didn't get an email after that, does that mean they're not needed? What are you doing to close those out? So I am preparing to send emails today for those that we have staffed. We only have the first couple of missions staffed right now, so hang in there with us and we'll keep going.
If the state is doing the investigations on a county resident and that resident identifies additional needs, how will they be helped? If we have special situations where there's additional needs, we're going to reach back out to the local public health department and see if they can help us work through that. A question about, since we're expanding contact tracing, can we contact employers or coworkers of a case and say they have been identified as a close contact, even if an outbreak situation has not been identified? Yes. So if the case themselves gives you a list of people that would meet that criteria, then we would recommend that you reach out to everybody that they provide and let them know that they've been exposed and give them the recommendations based on whether or not they're symptomatic. Are the test Iowa sites performing nasal swabs or serology? They're doing the PCR. So that would be the nasal pharyngeal swab.
Yeah, the next one's just asking for local public health to be involved in the initiation step, and that's what I'm trying to do. But please just be patient as we're working through this first week.
Are the test Iowa results going to be tabulated on the current county numbers on the IDPH website? Yes, so we're working to get those results reported through IDES like all other testing results, and then they'll be kind of just folded into the process, just like any result from a healthcare provider. Question about, will we be sending out new guidance for contact tracing? Yeah, we'll go ahead, we'll put some additional guidance together and send that out. Can you repeat what's needed for quarantine of symptomatic versus asymptomatic? Sure. Basically, if you're asymptomatic, we would recommend that you isolate through 7 days after the day you're tested. If you're symptomatic, we would recommend that you isolate until the 7-3 rule is met. By that, I mean at least 7 days after your symptoms started, at least fever-free for 3 days, and all symptoms have improved, or all respiratory symptoms have improved. We're getting some questions about clarifying guidelines for churches and the new proclamation about counties that can have some increased openings. Again, we would defer those questions to the governor's office, and we can resend some phone numbers for the legal group who's answering those types of questions. Should we be testing packing plant workers at the hospital, or should we be contacting public health with ill packing plant employees? And we would recommend that you work up patients just like all patients the same. So please continue to provide your standard care and test if appropriate if a packing plant presents for care. Part of what we're trying to understand with these large strike teams is just looking at persons who may be asymptomatic and infected so they can be excluded, and also looking at serology to help the business understand what percent of their workforce may have already been impacted. So yes, please provide care as normal when a packing plant employee presents for care. Will the IDES results state that the test was done by a strike team to help local public health with follow-up? So we're working out the logistics of that. Most likely, the way you would know that is the ordering provider would be the medical director for that facility. So you may be able to tease that out, but there's not a way that we can subset case reports related to specific businesses in IDES. We wish we could, but certainly if you have questions about that, you can reach out to us. For it to be an IDES. Do we have to wait for it to be an IDES before we contact the person? I feel like that maybe was part of an earlier question. I'm not sure I follow it. If you want to re-enter it, that'd be great.
The next one says, is there a way for local labs to know when the strike teams are coming? We've scrambled several times to get media in and then find out usually just by governor's press conference if we catch the states coming in. If the local public health and local EMAs could let local labs know, that would be great. But like I said earlier, SHL and LabCorp are currently doing the testing and the supplies.
A question about if counties have turned over case investigations to IDPH, will IDPH be notifying local PSAPs of positive cases, or will that be the responsibility of local public health? That would still be the responsibility of local public health. We don't have a mechanism to do that efficiently. So we're after our 1 o'clock cutoff. We've got quite a few questions in the queue here. A lot of them are repeat questions. Just give us a second and we'll scan them. A question, when is starting Monday? Is that last Monday or next Monday? Can you give us a date? Yeah, it's Monday.
May something.
I'm going to be honest and say
May 4th?
I probably couldn't tell you what day of the week it was right now.
I don't even know what the day is today. What is the day today?
Monday, May 4th. And again, we'll get some guidance out on that. So thank you.
Yeah, so that's my fault. It was about the lab strike teams and getting the results in 48 to 72 hours. So if that's not true, I apologize. It's probably longer.
A question about, is there an expectation that local public health do case follow-up on the weekends? I think if you're able to do that, that would be great. Part of that is an operational decision that local public health would have to make, but we would appreciate it. Just for your frame of reference, the teams that we're doing are working 8 to 8 Monday through Friday, and 8 to 6 on Saturdays and Sundays. Does IDPH provide data sets to be loaded into Tableau and soon into Domo? Honestly, the process we would have to take to divide those data sets out by county would be probably too labor intensive for us to manage at this point. But going forward, again, there may be some county specific data that we can pull out of Domo. At this time, I guess the answer is no.
I don't know what that means.
Okay. All right. I think, again, for the interest of time, we are not going to be able to get to all of your questions, but certainly we appreciate everything that you're doing. We appreciate your patience with us. We know that things are changing rapidly, and just really appreciate your partnership. So thank you very much, and we'll talk to you next Wednesday.